increasing 5 to 15, at that time there must be many of the having some problems. Any medicinal problem, mental problem, working problem, educational problem, financial problem. Because of that, what happened? Number of that patient will be sick. He is taking a lot of medicines, everything, and that time 5 to 15, the susceptibility is going slightly down, but it remains stays up to age of 30 years. And up to 30 years, he has more and more burden, and he has the tendency is changing, the body tendency is changing. At that time, again it goes down and down, because when the age is increased, at that time the number of people are suffering from the number of diseases, they are taking number of medicines from different system of treatment. At that time, because of his activity, there are tear and wear, as well as the different degenerative changes occur in the body, and therefore at that time the susceptibility is going down and down. This is the one of the chart which we have to observe whether in the childhood susceptibility is high, and when in the young age it remains steady, and after that it goes down, and according to that we can select the medicine. But this is only the parameter which is given by the selection of the potency. If anything individualized, you will find out, and then you can give the different potency at the time, because the judgment of the susceptibility is not only from the age. There are the lot of factors are there which we have to just. This is the one case, a case of female child age 8 years suffering from the acute tonsillitis with high grade fever 103 Fahrenheit, onset suddenly from last night. Child was playful but dull during fever. I am not explaining the rubric, why I am given the potency. That's just I am explaining in short. Now here the child susceptibility is high. Energy level too good. Patient is having a nervous temperament. Miasm, that is the functional change, that is SORA. And the selected medicine from plant kingdom, that's why I have given, that is the belladonna 1 dose. Up to the evening, the child will be completely cured. No complaint. Now, here I am given the susceptibility high as per the age, no problem. I have taken the previous history of the child, because the child is under my treatment, so I know that the energy level too good. You can observe it by the playful. Patient is nervous temperament. The sensitivity, when you observe the patient, the child, what is the reaction of that child? Whether he is clinging to the mother, what is the condition, what you assess during that thing, it is very important. Then about the miasm. Now, as you know that there are the 3 miasms are there: SORA, psychotic, and syphilitic. When there is a no any changes organic changes, high degree of susceptibility, functional changes. At that time, the sora is behind this. So when we are treat the disease, any disease, we can treat the according to the miasmatic condition also. That selected medicine is the plant kingdom. Now, there are the number of 9 sources of the medicine. Within the 9 sources, there is the plant kingdom, animal kingdom, mineral kingdom, nosode, sarcodes, imponderblia, isode, allersode, and one is more is the prepared from the various types of medicines. So that is the, so these are the sources. Now according to this source, when the plant kingdom, we can see the sensitivity of the plant kingdom is very high. They are ready to act in quick manner, easily. Suppose for example, if you have given the medicine of the plant kingdom to the patient will recover within the few seconds, few minutes. But if you have given the, because the action of the medicine will take the quick. What is the nature of the plant? It will shrink easily. It will open easily because of the nature changes. So sensitivity of the plant patient is the plant kingdom is very high other than the animal patient. Animal kingdom is the gradual action of the medicine. Mineral kingdom is also gradual action but deep action. So these are the changes in the that we will discuss later on, but this is the belladonna 1M according to the susceptibility, energy level, miasm and kingdom of the plant. Now the important factors which is related with the another important thing is remain here, that is about the sex, male or female. In the number of books it is mentioned that the factor, if the female is living in the village, they don't have that much intellectual work. They are doing the labor work at the home, but now the whole part is changed. Now there is no need to mention the separate susceptibility factor about the male and female. This factor will be judged according to the individual personality. According to the individual personality. So you can judge on the case to case. Because in the previous theme it is given that the male, if the male person is there, the susceptibility is high, he is highly working in the official work, so we have to give the high potency. In the female is there, then the female is very sensitive, he is not that much working capacity as compared to the male, then you have to give the low potency. But this is not true at this point. Every woman, every male is having their own capacity, and according to that, this thing you can find out and judge the susceptibility of the individually. Now next is factor is constitution. The constitution is very important role in the classical homeopathic practice of potency selection. Constitution means the ability. The constitution means the thing which can be having a capability of that particular constitution. So there are the Gorwal has given the three constitution: oxygenite, hydrogenite, and carbonitrogenite. Now, oxygenite. Oxygenite constitution is characterized by the accumulation of the excess of oxygen with resultant destruction of the tissue. How? When I was in the college at that time, I am also not getting this part. What happened? The proper hinder the proper oxygenation of the blood and the tissue by the predominant waterlogged or hydrogenous condition. Waterlogged or hydrogenous condition. So the oxygenite tend to excess of oxygen present, and consequently they exaggerated the breaking down the hydrocarbon, nitrogenite, and albuminous tissue and bones, and due to that there is a ulceration is occur. At this time it goes toward the syphilitic condition, destructive. That is the destructive condition. The blood is the product of organism, and its elaboration is handed down from parent to children. When anybody we say that this is the child of so and so. So the blood from parent to children, that is from generation to generation. If you observe the people from the Kerala side, different working capacity. If the person who is from Maharashtra side, the different. So why this is? Because of the constitutional factors. Whatever the blood goes from parent to children, so according to that the immunity may be inherited. Inherent power of the immunity, working capacity. So if suppose one potency I am giving in the Maharashtra of the same category of the people, that will not right for the Western people. That is not right for the different state of the region, because their environmental process is different. Their food factors are different, and according to that also the blood which was going on, that is also to differ. So you cannot copy the potency from one person to the another. You can judge by your own self. A weakened power of the resistance against the destructive energy of the oxygen maybe acquire the attack of epidemic diseases. Now if you observe, there are number, now the pandemic is going on, that is the corona. The susceptibility, here the susceptibility against that virus is going down. In some region it is too good, nobody can be affected. Now this is the important factor about the oxygenite constitution. Oxygenite constitution, the body is thin, thus according to the changes of the season, the patient will get the infected. Destructive disorder, genital diseases, and the body is prone to the ulceration for the self-destruction. So this type of oxygen, excess of oxygen, you will get the in the syphilitic condition. Next is about the carbonitrogenite constitution. Here the excess of carbon and nitrogen due to that insufficient oxygenation. Now suppose I will just ask, if suppose anybody is suffering from the corona, what the government is doing now? They are giving them some nutritious food. They can take the proper health care and they give them the discharge. If you observe on this constitution, you will get the idea of what type of peoples are there. So excess of carbon and nitrogen or the insufficient oxygenation complaint are caused by the retarded nutrition. This constitution is marked by the obesity, which is followed by albuminide decomposition like hydrocarbon. This is albuminide decomposition like hydrocarbon. Therefore, the peoples are suffering from rickets, osteomyelitis, emaciation of the body. The respiration is faster, shallow. Patient is very frequent pulse. Respiration is high. Extraordinary impatience. Erratic working about the heart, lung, kidney, liver. All these factors will be, and due to that there is the short breath, rapid constipations, diarrhea, everything. Irritability and impatience patients are there. At that time, we can only recommend the patient is such type hypotensive. In the oxygenide, low potency, here it is high potency. And in the carbonitrogenide constitution, why we are giving the high potency? Because if you observe the meism, it's a functional disorder. Chloric meism is behind this carbonitrogenide. No organic changes is here. Then oxygenide constitution. Oxygenide constitution is characterized by excess of water present in the body. This person will aggravate by the moisture, humidity, always prone to dropsy, suffering from the tissue growth of benign type, mark the periodicity of the complaint, always having a psychotic tendency. Always having a psychotic tendency. This person will always affected from the raining. Where there is an excess of water, this patient will get the complaint. That is Dalkamara, nitrum sulf. All these are the very, so we can recommend this particular constitution person's case hydrogenide low potency. Now this is the case. A case of girl, 22-year, unmarried, having complaint. Right breast, stony hardness swelling since 2 years. Having a joint pain, profuse sweating, burning palm and soles. We have taken the mental, that is a weeping tendency, always spoke with weep. Irritated, peevish and impatience. There is a history of appendicitis. As per my view, this is the chronic case. So I have find out for the constitution. According to the constitution, this girl is hydrogenide constitution. Meism is psychosis. Energy level, as per my view, that is the medium. Patient has a too much weeping and impatience disposition. So as per my view, I have given you the slide that the hydrogenide constitution, we have to give the low potency, but here the individual factor, the case is chronic, and to remove the chronic miasmatic dyscrasis, we have to use high potency according to the disease level. There is no any fixed parameter should be mentioned in any book regarding the selection of potency. There are some parameters which was mentioned and given according to the individual experience and accurate observation. The selected medicine is Medoranum 1M, and this medicine is the nosode, and that patient will be recover without any second dose, without any second dose. After 3 months, again he has visit to my clinic. At that time, the patient almost all 70% complaint, and after 3 months, I have given only SL. After 3 months, the patient stony hardness, swelling base is removed. He has done the mammography. The patient will be all right. Now, next important part of the selection of the potency, that is the temperament. What is the temperament? Temperament will give you the idea about the personality. Which type of person he is. Whether the person is extroverted, whether the person is introverted, whether the person is relaxed or sensitive. So you can differentiate this particular temperament. Number one, chloric temperament. Number two, sanguine, full-blooded, melancholic, relaxed, sad, always oriented, phlegmatic. So in the chloric or sanguine temperament, we always try to use the high potency, and phlegmatic and melancholic we have to use the low potency. A person nature, especially as is permanently affected their behavior, tendency, that is called temperament. Chloric temperament, extroverted. He is a goal-oriented person, highly ambitious. Here the energy level is high. And because of that, we are giving the high susceptibility, high potency. Everywhere the susceptibility we can connect. Then sanguine temperament, full-blooded person, charming, quick to react, very impulsive in nature. Here the full of energy, more than the chloric temperament. For example, aconite person, sanguine temperament. So at that time, susceptibility is too much high. Again, we can use the high potency. Then about the melancholic, reserved person, self-reliant only, organized, very passive, inert, keep quiet, relaxed, energy level is down, susceptibility is medium or low. We can use the low potency. See how much it is. It is mentioned everywhere, but the judge is physician. Everywhere the judge is physician. He can assess this thing in the patient, and then he can realize whether the patient is in that group, this group, or in anywhere. Then next is phlegmatic. Patient calm, shy, exaggerated feeling. There are many patients, they are exaggerating symptoms. Unemotional, self-contained. This is the very good. Self-contained, easily not react. There are many times when we ask the patient, tell me about your family history, tell me about your mental condition. How will you say? How will you react? They will not say something, keep and quiet. So here also the energy level is medium, because the action or the quick reaction of the patient will give you the idea about the temperament. If we relax, he is relaxed, we can say that is the, when we say anything, the patient is no, no, no. So at that time, the susceptibility of the reaction of that particular person, phlegmatic person, is low, and therefore the low susceptibility is there and low potency is used. Now this is also the one of the important habit and environment is there. We are generally using the high potency of those people who are intellectually work. So this intellectual work, what is that intellectual work? The person who is having a mental work, doctor, lawyer, politician, then the person who is having a sanitary occupation, that is shopkeeper, and who take the long sleep. The person is in the effeminated life, humanism, feminine nature of the boy, that is the male. These peoples are very intellectually keen. So they are having a high susceptibility, and this high susceptibility we can use the high potency. The person who is a labor work, physical work, little sleep, continue to expose various drugs, influence, idiotic nature, dumb and deaf, we have to give the, because the susceptibility of this type of peoples are low, and we have to give the low potency. For the environment, the worker, those who are work in the chemical factories, drug factories, always influence under the tobacco dealers, tobacco workers, perfumers. All these peoples is under the impending some power on him, and due to that the reactive power is less, and we have to assess the susceptibility low, and the low potency should be given. But again, there is the person who is working in the film industry, the excitement, imagination, imaginary, emotionals. If suppose one actor is there, he has to produce the excitement. He has to imagine that my mother is there, and he has to take the scene. So these type of emotions, excitements, these peoples are very much highly susceptible, and this highly susceptible person will put the high potency in the. We are just explaining about the environment. Now second part, that is the disease, nature of the disease. First part, susceptibility of the patient, age, sex, then environment, habits, constitution, temperament, all these things are. Now second is nature of the disease. The seat of the disease is very important. more important organ, less important organ. More important organ, if there is any pathological grave disease is there, for example, valvular disease, cardiac valvular disease. At that time, what happened? We have to give the medicine in low potency in the mother tincture form. For example, Crataegus mother tincture, 15 to 20 drop. Important organ, but the susceptibility is reduced due to the pathological changes, valvular disease. But if that person is healthy and some functional changes is there, at that time we have to give the high potency. Less important organ, for example, suppose for example anybody is suffering from skin complaint. So this skin complaint, if anybody is suffering from the skin eruptions, eczema, whatever it may, at that time according to the individual factor we can give the high potency, but according to the individuality mentioned. That is important about the more important to less important. But when we are selected the medicine for more important organ, for example liver, lung, heart, all this vital organ, we can cautious about the selection, because there are many drugs substances, for example the drug belonging to the mineral kingdom are not to use in the renal failure because of some particular reason. So that is the also important about the selection of potency. Then nature and the depth of the disease. As you know that there are the two type of general disease we are considering, that is acute and chronic. In the acute disease, means no structural change. Acute disease means no structural change. When there is no structural change, the rapid progress of the disease, and this rapid progress of the disease is having a part of high vitality, high susceptibility. At that time, we have to give the high potency. For example, chickenpox, measles, influenza. These are the, suppose for example, is first day, you will observe this thing. Within the night, you will find out the another progress of the disease. Acute disease. Suppose for example, common cold. We can take the common cold. There also the high susceptibility is there. If the symptom similarity is there, we can, according to that, we can find out the high potency. But in the high potency in the acute case, we cannot repeat the high potency frequently, because it will affect or it will arrest the progress of disease. Why? Suppose for example, if any person is suffering from any complaint, what it means? It means the disturbance of the vital force. If the disturbance of the vital force, it occurs the disease, you will get the symptom. According to the symptom similarity, we can select the similimum remedy. When we select the similimum remedy, according to the intensity of the disease, measure the susceptibility power, depth of the disease, we can select the potency. When we are selecting the potency, the medicine given to the disease, that is called primary action. If once we given the high potency at once, the primary action of the one dose will cover the disease force, and from that we get the secondary action in the form of curative or counter. Counter if it is opposite, curative it is similar. But if we repeat the dose, so the primary action of the second dose and the curative action of first dose is polite, and you will get the arrest the progress of the disease, and you will get the aggravation, and the patient is suffering from. So it is very cautious when we are selecting the. Now what happened? Everywhere we are saying when there is a high susceptibility, high potency should be given. But in acute case, maybe there is a low vitality is there. Maybe there is a, in the, for example, in the severe dehydration, there are a number of people are there. Diarrhea, vomiting, shock, severe bleeding. At that time, the vitality is low. When there is a vitality is low, the susceptibility is also low. And when the susceptibility is low, at that time, the patient only require the low potency in the repetition. In acute case, both the diseases are there. High vitality, low vitality. So at that time, we must give the patient about 6, 12 or 30 potency up to maximum, not more than that. Why? Because we have to judge the condition of the patient, vitality of the patient. And this vitality will give you the idea about the to choose the potency. Second is in acute crisis, chronic trouble is there. There are the many times acute manifestation is occur in the chronic case. For example, acute heart failure, AHF. What is the manifestation there in acute? What is the acute manifestation there? For example, shortness of breath, difficulty, shortness of breath, difficulty in breathing. Now again, there are the two things are there. Whether the gross organic changes is there or beginning of the gross changes, beginning of the organic changes. If the gross organic changes is present there, at that time we have to give the low or medium potency. If suppose the beginning of the organic changes only the functional plane, we have to give the high potency. So in the every judge, every part, the physician is the judge, and he has to judge what is going there, and according to that we can select the potency. In the acute phase, in acute manifestation, in the chronic diseases, we have to judge in the both the way, whether it is the organic changes or non-organic changes. If it is beginning of the organic changes, then you can use the high potency. The patient will be quickly recover and it will get the cure from that chronic complaint. The next is chronic diseases. What is the chronic diseases? Chronic diseases are the three types. No organic change, high susceptibility, functional changes, high potency, only single dose is given, single dose. Many times, suppose for example, if the patient is suffering from any skin complaint from last 15 year, 20 year, at that time, what we are doing? We are taking the history, we are selecting the medicine as per the, if we believe in the different system, that is HHFian will select the medicine from HHF method, classical will be select the medicine from classical way, another system, and according to that, when there is a no organic change, ability to measure the intensity of the disease and the depth of the condition of the disease the susceptibility will measure, and at that time we can give the single dose of that medicine without repetition. If the first dose is exhausted within the given period, then you can give the repetition. Many times there are the many chronic diseases like migraine, neuralgia, the neurosis, maybe the paralysis. There, the susceptibility of that person is tend to beginner. At that time, we must in the repetition must be given. Otherwise, the patient will not recover. This is also the, in my observation, I found that this is the, if suppose neuralgia is there and without neuralgia means the pain, nerve pain. If we are not giving in the repetition, the patient will not recover and patient will run away from your clinic. So therefore, in the some cases, according to that, you must repeat, but that is your judgment. Then in organic change, as the susceptibility of the patient is gradually low, because the patient is suffering from the long continued period, and due to that, this changes will susceptibility become down and down and down, and that time we can always start from medium, low or medium potency. You can start from medium or low potency. If you get the improvement, and if your improvement exhausted or ceases, at that time you can start the next higher potency. This is the, because Dr. Kane in the 10th observation, he has mentioned that the new symptom appear after the remedy repeated, we have to stop the medicine there. So whether it is in the organic changes, whether it is in the, but generally when the symptoms appear, new symptom, at that time we cannot repeat the dose, we can stop there and wait and observe, and then we can give the, so the low potency should be repeated even in the organic doses until and unless the new symptoms are appear. After that it is stopped. Many times there is a other opinions are there. Maybe the high susceptibility is there. In organic changes, the low susceptibilities remain, but we have a individuality. Individually, we have observed many things. If suppose there is a high potency is there, then high susceptibility is there, then because the aggravation is quick, it is stronger, patient is in rapid progress of the case. So at that time, you must give the high potency. If organic changes is also there, it is mentioned that when there is a pathological change, organic change, we have to give the low potency. But if the susceptibility is high, the patient is quick to aggravate, quick to react, strong, rapid improvement present there. Suppose, for example, if the patient is suffering from the ulceration and we have given the 30 potency, patient is show the progress quickly. Can we repeat that potency only? No. Here the susceptibility increases, tend, then we can give the high potency. That is the susceptibility tendency. But that judgment must be observed by the skillful observer, skillful physician. In this change, high susceptibility, Dr. Kent has given in the third observation. It is mentioned that the patient passes the crucial or the grievous suffering before cure take place. It means that aggravation must be present. When it is improvement, we have to mention the particular potency there. Next is mental disease. In the mental disease, everywhere it is the high susceptibility is there, but high susceptibility in the mental disease, high potency is contraindicated. Look here, what is the changes which is observed by the Dr. Henneman? High potency, high susceptibility is contraindicated in the highly pure mental condition, mental diseases. Suppose if you start, there is a possibility of the high violent aggravation. Everywhere is saying that if it is psychosomatic disease, judge, you just give this potency, high potency. You just give the one dose to whatever it is. But this is not the actual fact. Who are practicing as a homeopath, he must observe the thing, because the condition of the mental condition, depressive patient, is too much irritating. If there is a slightly homeopathic aggravation is there, then the patient will be changes occur, and according to that there are the many patients blame to the homeopath. So kindly, when the patient in under the mental condition, purely mental disease, don't give the high potency. You can start from the low or medium potency, and then you can give the high potency. So this is the case of a man aged 41 years suffering from the depression, history of taken allopathic treatment since 4 years. Now he has presented a complaint, slightly fever, sensitive to cold, want covering completely. Now in the acute phase, you want to start the homeopathic treatment. किसी ने बताया होम्योपैथी में अच्छा होम्योपैथिक मेंटल सिम्टम इस पर दवाई है. So he came to us, great loquacity, anxiety about suffering, anxiety, religious affection, fear of suffering. I have given the stramonium 201 dose because the mental sensitivity, susceptibility is high, energy level is too good, Myzum Sora, the medicine belonging to the plant kingdom. Second day, the fever raised 102 degree Fahrenheit. Patient is restless, anxious, frightful. Susceptibility increase here. It means it requires the higher potency there. I have given the stramonium 1 m. Patient within the 4 days completely cure. Second day the fever was down. Within the 4 days, near about 90% depression subside. After 3 months, the patient will be all right. If this time, when the patient is restless, anxious and fearful, if I have not taken the decision to increase the potency, I fail to cure this case. So this is the magic of potency. Next is duration of the stage and duration of the disease. Stage and duration of the disease. Now, there are the incurable chronic diseases and terminal stage of the chronic diseases. Incurable chronic diseases means the case difficult to treat, where there is a irreversible changes are occur. Now what is our role in this particular case? Where there is an incurable, we have to make it curable by their own power. What we are doing generally, we are giving the power to the body. Body itself can recover from the disease force, and then he will balance their own vital energy. So what is here? Incurable. Incurable word is there. So incurable in such a cases, to avoid the severe aggravation, we have to give only palliative remedy on the symptomatology for prolonging their life. Suppose the patient is suffering from cancer, incurable. At that time, what happened? In the first stage, if he has visited to our clinic, what we are doing? We are making the history. We are taking the history, and at that time, we can select the potency on the basis of 6, 30, mostly maximum 200. If it is not work, go to the LM potency, because here the susceptibility of the patient is too low. Because when anybody uh, suppose he has taken, if anybody knows that he is suffering from the cancer, again the mental power is also depressed, susceptibility is low. So at that time, many times what happens, the material dose is also not working. So at that time, you can go the highly intensified dose, that is the renewed dynamization, that is 50 millisimal potency, and there we get the palliative. Even I have seen, even in the incurable stage, it turn into curable because of 50 millisieverts. So take the chance, this is your chance. And next is terminal stage of the chronic disease. Here also the status is the same. According to the status of the disease, we can select the LM potency for the palliation. In the third stage of the cancer, we cannot do anything. We just wait and we have to give the palliation. And for the palliation, the 50 millisimal or LM potency is the, because if we have given in the low potency, the patient will not work and the pain will be there. So this is the important about the, maybe in the 50 millisimal scale, we can make the repetitions many times, and at that time you will get the proper. Now, next is the history of previous treatment of the disease. History of previous treatment of the disease, it is very important during the homeopathic treatment, because the homeopathic physician must assess the vital susceptibility of the body. Must assess the vital susceptibility, because what happened? I think 70% of the patient come to us from the allopathic side. They are taken different treatment from the different system, and then he has given us the chance to treat with the homeopathy. But up till that time, there is a lot of suppression, lot of disease there on the vital force. Go through the careful observation and accurate experience about the disease force, about the disease. You will get the knowledge about the selection. Because suppose in the general how the disease occur, and at this time what is the difficulties in the disease, what is the complications in the disease, we can find out, and according to that you will get the vitality of that particular person, and then you can select the dose of the medicine and repeat according to that. Because generally what is our aim? Our aim to wake up the vitality of the patient, because he has taken the lot of medicine from the crude drug, allopathic treatment, homeopathic treatment also. So therefore at that time, whatever the symptom similarity selected on the basis of symptom totality on the physical and mental level, you must go the high potency. If you heard one more thing, from the Bombay side homeopathic physician, they are always start with the high potency. Why? Because of the history of homeopathic previous disease. History of homeopathic treatment of the diseases. This is the important about the selection of potency. Now this is the repetition of the doses of the medicine. As per the Dr. Henneman has instruction about the repetition of the doses in the 5th edition of Organon of Medicine. Condition and progress of the patient, nature of the disease, and nature of the remedy. Condition and progress of the patient. As per the aphorism number 245, perceptible and the continued progress of the improvement contraindicate the repetition. Why? Because every drug is having a primary action from drug to the vital force. From every vital force is having a secondary action, which is in the form of counter or the curative action. If we repeat during the progress of the continued progress or the improvement of the case, the effective case arrest, and you will not get the that much action of the drug which we are applied. So therefore, as per the aphorism, perceptible and continued progress of the improvement contraindicate the repetition. Repeat the dose only when improvement ceases. We can also increase the dose here. Suppose, for example, if you have given the 30 potency dose, the dose is 30 potency, then we can, if you feel that the susceptibility is more, you can give the 200 potency. Third is, as per the aphorism number 248, the repetition may be continued either recovery ensure or different group of symptoms arises, thus demand the different remedy. Aphorism number 248, repetition may be continued either recovery ensure or the different group of symptom. It means what happened? There are many times the patient is improving the case, but the different symptoms are appear. It means what happened? Our selection must be somewhat wrong, maybe. So the group of symptoms appear, we can again take out the totality, select the remedy and give the potency. So at that time the repetition must be. Now in the nature of the disease, first is condition and progress of the disease, second is nature of the disease. Nature of the disease. In the nature of the disease, there is acute phase. In the acute disease, what we are giving? The medicine may be repeated at the interval of the 14, 12, 10, 8 or 7 days. But if suppose the patient is suffering from the severe acute complaint and the 14, 12, 10, 8 or 7 days, who will stop? So again, I will give you the advice and it is my experience. As per the need of the intensity of the disease, as per the need of the susceptibility of the case, we can repeat the dose according to that. This is the medicine interval is only given according to the power of the disease. Suppose for example sulfur act only 60 days. So this is the belladonna act for the 3 days. So this is the action of the remedy which was mentioned in the posology. According to that, it is the given. So, but if the disease may be repeated at this interval, you can also make it less. Acute form of the chronic disease. There are the many patients who is suffering from the acute complaint in the chronic diseases. At that time, you must repeat the dose frequently for 4 hourly, and you can stable the acute complaint, and you can continue the. Suppose for example the selected medicine is Chloric, and the patient is suffering from the headache. You have selected the DD, that is the Chloric. You can give the acute remedy, that is the belladonna, in repeated form. You will not get the disturbance of the action of the potency. The next is chronic disease. The medicine may be repeated very short interval period every 24, 12, 8, 4. In most acute diseases, every hour should be given every 5 minutes. So, in the chronic disease also, there are the many of the complaints should be given in acute form also. In the disease, there are the stages of the disease. The two forms should be observed everywhere. One is dynamic pathology, another is organic pathology. What is dynamic pathology? The very beginning of the disease, where there is no structural changes, there the high susceptibility is there. Only single high susceptible patient, you can repeat the dose, then it turns into the organic pathology. Single dose should be prescribed there, but if in the repetition you have given, thus the organic pathology will be developed. Organic pathology where there is an end up of structural changes. Susceptibility is low and you will get the low susceptibility and low potency should be given. Then there is a nature of the medicine, nature of the remedy. According to the every source of the remedy having their own ability or power. There are the short acting remedies, deep acting remedies. The short acting remedies, there is the remedy generally from the source, plant kingdom. The deep acting remedy generally from animal and mineral kingdom. You know the nosode is a deep acting. Sarcodes, it should be always given in the low potency. Nosode always given in the high potency. Short acting remedy is generally used for the acute cases, acute diseases, because it is very effective in the quick to action. If suppose anybody is suffering from the headache, severe headache, if you have given them the lycopodium, it is the inert drug. If you have given other drug, it will not work that much as compared to the drug which is prepared from the plant kingdom. It is quick to act, it is quick to react. So the short acting always should be given generally in the high potency. Deep acting drug should be start from the low potency and it goes higher and higher and according to the which is belonging to the animal and mineral kingdom. Now this is the case. This is the case of a girl age of 8 years, suffering from leukoderma since 1 year. On the basis of symptom, I have prescribed them the Lacasis 30, 3 dose. After 1 month, improvement ceases. I have given the 200 potency of the 1 dose. See the improvement. After the 3 month, 1 m potency should be prescribed, single dose. And after 6 months only, Saclag is continuing. Still the improvement is there. Still the improvement is there. Now this is the another case. A case of child having age 10 days. Patient father come to me on the 1st of May. He has shown me the photograph of child. Child is in the hospital. After that, I have given only Ferrum Phos 200, nothing. 3 dose. On the 5th of May, again he has shown me the picture. Then I have given them the medicine on the basis of symptom similarity. On the 7th May, changes occur. Again patient come to me. After I have given them SL. On the 9th May, again he has visited to our clinic. After 3 days, improvement is going on. And after that, 17th May, the patient will be all right. Now, a case of child, male, of 10 days had fissure in anal region. His mother, during the whole month, 9 months, he is under my homeopathic treatment. At the end of the March 2020, the corona pandemic influence starts spreading all over in the Maharashtra, in India. But the pregnant lady had completed her gestational period of 40 weeks. Now she has developed the fear deeply and feel danger from corona atmosphere in the hospital. She has tremendous anxiety about the health. Due to this, her husband changed one hospital from government to the semi-government for safety purpose. On this short review, patient is almost my old patient, so I have prescribed them the nitric acid 200. Nitric acid single dose on the 5th of May. This is the case analysis about the anxiety, health, about fear, disease of impending, horrible things, sad story effect, and due to the feel of danger, on that basis, I have selected the nitric acid. I just conclude with my some practical tips which we have to describe for the physician. The physician must be intelligent and skillful observer. Now what happened in day-to-day practice, number of physicians are not observing the basic part, basic thing of the case. What the patient is saying, why the patient is saying, what are the movement of the case, Why these patients say like this? They are trying to impress himself to the patient, and because of that they are lost many more cases, many more things during the case taking. So try to find out the observation, why this patient is looking like this to us when he entered your cabin. He must also have an experience to assess the case susceptibility individually. When he assesses the case susceptibility, then he can select the most minimum remedy on the basis of source of drug. Most minimum remedy on the basis of source of drug, whatever the method is they are applied, by mind method, by classical method, but the potency must be selected properly. Because unless and until you can find out the aura of the case, the energy level of the case, the vital level of the case, we cannot judge the susceptibility, and we cannot judge and we cannot give the potency properly. In every case, the unique specialty is having their own vital level, every case is having own vital level. Whether the mother, father, everywhere, every individual person is having their own vital level. You judge the vital level, you go to the case. He must also have the knowledge of the disease. We must have the knowledge of the disease level. Disease level means, suppose if the person is suffering from some cough, cold, coryza, that is the functional change. If the person is having some ulceration, that is the changes in the tissue, organic changes. We must know this level, and according to the level we can find out the which dose is affordable to that particular case. He must be free from prejudice thing. Now what happened? Now Dr. Chincholkar has given the advice. If suppose the susceptibility is high, we can just select the potency in high and give the to that particular. Don't do this thing. Every individual case must be differ from each other, and every individual power must be differ from each other. So therefore, we must not to keep anything. Unprejudiced observer must be required. He must know all the fundamental principle of homeopathy. Fundamental principle. He must have clear-cut idea what to do and what to not do. Law of simillimum, law of similia, law of minimum. Minimum dose, the dose which can arouse the vital force. The dose which can arouse the vital force, that is called minimum dose. Dr. Hahnemann has given or mentioned in the aphorism number 242 about the minimum dose, intervention of the minimum dose. When the minimum dose is given, the dose which is sufficient to arouse the vital force, stimulate the vital force, that is called. So these are the similia, similibus, curanture, that is the fundamental principles, that is the law of vital force. He must also well studied about the sources of remedy. Every source is having own affinity, own ability, own power. Suppose the plant kingdom, generally the plant kingdom is very sensitive. Generally we can use in the acute case, we can give the high potency. It means plant kingdom remedies are not using in the low potency. This is not the rule. Again, the individual case we can find out, and according to that the susceptibility is there, we can give this. But generally, if you want the quick action, don't give the animal or mineral drug. You will get the action quick more than animal and the mineral drug in the plant kingdom. That is the source. Animal drug and Mineral drug is the deep acting drug. And this deep acting drug is specially uses in the various chronic cases, and it should be start from the medium or low potency. Nosode, high potency. Sarcodes, low potency. Different isodes and alersode, it should be given in the medium or low potency. Coloring matters. So all these are the sources of the remedies. You must know the cure and the improvement of the disease depend upon the power of organism. The cure and the improvement of the disease depend upon the power of the organism to react to impression of the curative remedies. This is my last word. The cure and the improvement of the disease depend upon the power of the organism to react to the impression of curative remedy. This is nothing but the reaction, the action, everything depends on the susceptibility of the case, living organism. And I'm very much thankful to Kerala Association who has given me the chance. I think if anybody is having any question regarding with the potency, you just ask me,
Thank you
and
so
then
much,
I
sir.
will.
Thank you so much, sir. It was such a wonderful session. And I request all the participants, if you have any doubt, you can put in the chat box. So, can I read the doubts, sir?
Yes, ma'am.
Okay. So, the participants are asking about rule of LM potency. What's your experience regarding LM potency?
Rule of LM potency where the susceptibility is too much low and we cannot give the high potency, but the patient, the disease level is too much in the deep level. To goes to the deeper and deeper penetration, we need the high potency. And this LM potency is the that much potency, that is potency which can goes to the deeper penetration, and it will uproot the all the disease to the outside the body. So this at this level we can always use the LM potency. Where the susceptibility is low, the chronic case is there, and we cannot judge the potency. We cannot judge the potency. When we cannot judge the potency, we just always use the LM potency in the repetition. Suppose, for example, if the LM potency medicine is wrong, and if we cannot get the result, we can change the medicine. We will not get the any harm. But if we have given the potency in medicine is given and it is wrong in high potency, then we have to antidote that remedy. This is also the very much advantage in the LM potency. So where the susceptibility is low and there is a high deeper action we need, we have to give the LM potency.
Okay, doctor. We have two or three more questions. Please explain the relationship of cause of disease in chronic cases with potency selection.
Cause of
Okay, I will read again. Please explain the relation of cause of disease in chronic cases with potency selection.
in the chronic cases, we again go the miasmatically, madam. In the chronic cases, we are always thinking about the miasm, that is the sora, psychosis, and syphilitic. In the sora, where there is a functional changes is there, at that time we can use the high potency. In the psychotic, there is a growth, that is the medium or low potency should be given. And in the syphilitic condition, there is a destructive cause. At that time, we can use low or medium potency. Now, every chronic case is having a miasmatic causation factor, and according to that, we have to give the value to the SORA, psychosis, and syphilitic.
Okay, sir.
Anything more?
Uh, in the first case, uh, can we have first give high potency like after allopathy medication, and later can we come back to lower potency?
But once we given the high potency, the low potency will not work.
I think I'm not getting the question what the participants wants to ask. Sir, actually the question is not clear itself.
You just tell them once, suppose for example, if anybody has given the high potency and he has to change the potency to the low degree, but there is no use of once we fire in any potency, we have to fire on the next potency only in the higher region. Otherwise, you have to change your all medicinal part. Suppose for example, once you have given the belladonna 1m, belladonna 1m is given, and the belladonna calcarea carb is the chronic of the belladonna. So when we are, once you have given the belladonna 1m, the calcarea carb 200 you can start, no problem, because this is the constitutional drug calcarea carb, and belladonna is the acute. So in the acute phase, when once you are given the 1m, you can start the calcarea carb 200 or 1m.
Okay, doctor. And a basic question for you. What is difference between dose and potency, sir?
Dose and potency.
Yeah,
Dose means the amount of drug should be given at a time. Dose is the amount of drug should be given at a time, and potency means the power which is present in the drug. It is somewhat similar, but it is a different definitions. Suppose for example, potency is the amount of drug which is present in the given supplied sample of the drug, and dose the amount of drug which is present in the given sample of the drug. Are you getting me, Anupriya madam?
yes, doctor. From the beginning, participants are requesting for the doses, doctor. They want the repetition, the way of dispensing, that how you dispense the potency.
The way, I'm not getting question.
Actually, doctor, the participants wants about doses, that how many times you repeat the potency. Actually, in every cases, the patient in patient how we repeat the potency. How much? What is the
The,
criteria of doses?
the dose should be repeated according to the improvement of the case. According to the improvement of the case, if suppose for example on the symptom similarity we have selected the drug. After the selection of the drug, when we are proceed any potency, when we are proceed the potency should be given the dose. At that time, the second prescription or the second drug should be given according to the reaction of the first dose. Hello,
Okay, thank.
reaction of the first dose.
Okay, thank you so much, doctor.
Just a minute, ma'am. Anshul, come in. Just a minute, ma'am. Just I want to say something about
Yeah, yeah, sure.
last please. Last. You just tell them, ma'am, there is my email ID swchincholkar@gmail.com. If anybody is having any doubt about the potency or anything, you just tell them to send me the mail. I will clear the doubt.
Okay, doctor.
Just,
Thank you.
just a minute. Just a minute.
Okay.
Before before that,
Actually, doctor, there's no problem. We can extend the time, but the matter is that we have
okay,
another
okay. I know
yeah.
that.
This is
Just
the
I make one folder of my Sympathy Institute of Homeopathic Pharmacy that
yeah.
I'm searching. No problem. So I think it is. So I am very much thankful to Anupriya ma'am and all your Kerala Group
I'll
Association
have you.
and Deepu sir, all who has given me the chance to.
You can message Dr. Deepu, sir. Your participants are asking about your email ID, or you can give your number.
Okay,
So
okay.
you can definitely give to Dr. Deepu, and we will share in the group. No problem.
Thank you very much, ma'am.
Your some clinic address or whatever you want to give, you can send Dr. Deepu,
Okay.
and we will all share in the group, in Telegram, everywhere we can share. No problem. Okay, doctor. So thank you so much, doctor. It was a very informative session regarding daily practice. Every time we select the remedy, but we have many problems and we face many troubles regarding selection of potency and its repetition too. So thank you so much for your wonderful experience, and I hope with these sessions everybody have help in their daily practice. So thank you so much, doctor. From all IHMA Kerala State Chapter, I show my sincere gratitude to you. So thank you so much, doctor, and welcome for the further session.
Thank you, ma'am. Have a good day.